Good morning and welcome to ECPI News. This is Mackenzie Needham coming to you live. This morning I'm going to discuss a topic that's been a major priority in the United States for over 2 years now, COVID-19. In my opinion, COVID started out rough, really rough. It hit the United States like nobody thought it would. It's run down all sorts of medical staff, from CNAs to nurses to providers. We were running out of all sorts of supplies, from gloves, gowns, oxygen, ventilators, any kind of medical supplies, you name it, we were running out of it. The United States was rough. We were made to wear masks everywhere. We were made to get vaccinated. Luckily, numbers of COVID decreased. People started going out more often, going out without masks, refusing to get boosters. Slowly but surely, COVID is starting to come back up because now that everybody thinks that since COVID isn't around, it's not a thing anymore, that they can just go without masks, go without vaccines. They're not washing their hands nearly as often as they were, not being as precautious as they should be. So this morning, I have decided to do an experiment. What better way to describe how COVID-19 has affected the healthcare system better than to come to your local emergency department to talk to a local nurse to see how she has handled COVID. So today I have with me Brittany. Brittany has volunteered to discuss her opinion on COVID as well.
Okay, so at the beginning of COVID, I'm a new grad nurse. I think the patients were at first very afraid of COVID. They started being more compliant with their masks. They were stealing our equipments, taking our gloves, our Clorox wipes. Then when the cases went down, it seems like people were more non-compliant with wearing their masks because they feel like cases went down, like we're back to normal. It's summertime, like they wanted to go out, go on vacation. They didn't want to wear their mask because they thought it was too hot. And now the cases are coming back and it's getting worse.
So Brittany was nice enough to bring me to her department supply room to show me the difference in the supplies from now and then.
So I work in the emergency room and this is how stocked we are today. So here are our vital signs. We have blood pressure cuffs. Before COVID, we used to have the manual ones that we would use to just wipe clean, but now we have disposable ones just to stop transmission. And we just throw those away after each use. We have the IV kits, which is fully stocked now. We have fluids, needles. Here's kind of like our most important part for COVID because it's a big respiratory issue. So when COVID first started, we used to be basically almost empty on like nasal cannulas, BiPAP machines, things like that, but now we're completely stocked.
So hopefully within the next couple months, we don't have to go back down on these. Also, I have brought with me Devin to discuss his opinion on COVID as well.
My opinion on COVID is that it's probably going to be here for a very long time. I don't foresee it going away anytime soon. We have possibly gone past the point of it being eradicated. I think it'll be like the flu and it'll be here for a long time. In addition, I've noticed that at one point we were doing much better with our numbers. The numbers were winding on down. But as time goes on and people start to congregate in more closely packed areas, the numbers are going to go up. And they are. And I will continue doing my job.
All right, well, thank you, Devin and Brittany, for your opinions working in healthcare through COVID. I'm glad to see that we all have the same opinion. All right, so there was my opinion on COVID and a couple other medical professions on how they thought COVID went as well. Thank you for joining in, and we'll tune in next time.